third visit to Coimbatore, and level of academics and discussion is very high, and one can safely say I am here at Mecca of Orthopedics for India, and level of orthopedics is really high. Imageless versus image-based. I'll be talking on slightly controversial topic and a lot of questions regarding robotics. So friends, robo is a Czech word. It has arrived or derived from word robota, and that meaning of that word is forced labor or activity. You are asking someone to work for you. So that's the real meaning of word robo. Robots are in use in many industries where you need precision, productivity, and efficacy. Okay, so that's where robots will come handy, and they will help. First time it was used for neurosurgical biopsies in 1988, and later on same robo with some modification was used for prostate biopsy in 1991. Many surgical robots for GI, for abdominal, for onco-surgeries are used, but for orthopedics, first time it was used at Imperial College London. Robo name was Acrobat in 1980s, late 1980s, and later on RoboDoc from Think Surgical California in early 1990s, where it was used for TKA. These robots can be classified as a semi-automated or fully automated. We have Navio, Cori, Mako, Rosa. These are all semi-automated, where surgeon holds the robo in hand and then performs the surgery. But Cubis from Curexo is the only fully automated robotic system. Now we will be having Miso from Max Merrill. Imageless, where you don't need any X-ray or pre-op CT, and others are, they need CT or X-ray like Cubis, Mako or Rosa. So that's how we can classify these robots. So imageless robots, they have advantage of they don't need any investigation like CT or X-ray, but as a surgeon, definitely you need an X-ray before you enter the theater. Less radiation to the patient, less expensive because you don't need this costly investigation pre-operatively. Pre-op planning on CT, you don't waste your time on that. And if there are any implants in the femur and tibia, CT-based robots, there is slight challenge while doing this manual or auto segmentation, and then you don't get correct picture there. But it is difficult to locate center sometimes with these imageless robots, hip center intraoperatively. You need to mark malleolus, and if there are any tibia femur cyst, you can miss on routine X-ray, which you definitely find on CT images, and that makes you better prepared for implants intraoperatively. And sagittal plane alignment, there are some papers where the image-based robots, sagittal plane alignment is better as compared to imageless robots. So you don't need to mark hip center and malleoli and all these important bony landmarks when you are using image-based robots. Okay, so you don't need that. Image-based robo, the bony landmarks are marked intraoperatively, and like hip center, epicondyle, ankle center, all these landmarks you identify on CT images. You don't need to identify them again intraoperatively. You come to know, as previous speaker has highlighted, regarding the implant size and some findings like bony cyst. So this particular case, X-ray was not very convincing, and then we could find a huge cyst on the tibia on these CT images, and then we kept extension stems ready, and this is the intraoperative picture and pre and post-op X-rays of the same patient. But there are disadvantages of image-based robots where patient undergoes radiation, for this CT, radiation exposure is there, and then expensive pre-op planning is required, and there are prior implants in femur and tibia. It is slightly challenging to plan cases on image-based robots. So friends, I'll try to keep it simple and sweet. So similar outcomes in literature for image-based and imageless robots. There are pros and cons for each and every system, and we need to identify those pros and cons. We need to learn those things, plus and minus for this system. Robo is here to stay, but we should not be using it just as a marketing tool, okay? If you keep on using it, then you can learn those finer, fewer things, and where that will definitely help you to improve outcome for your patients. Thank you very much.